Now, by coincidence, when a health screening was conducted at our factory, the doctor and the nurse with him found that my pulse was 148 during a routine blood pressure measurement. And after that, my pulse was monitored continuously for 3 days. It turned out that my pulse was consistently high, and they referred me to a cardiologist. After my examination, a lady doctor named Miss Zeynep referred me to Mr. Mustafa. When I went to Mr. Mustafa, he performed the necessary tests. He explained to me, one by one, all the procedures that needed to be done according to the chart and convinced me. He is also a very gentle person. It didn't feel like a typical doctor-patient relationship at all. It was more like a brotherly bond, and he made me feel that warmth. They gave me a date, so we came. I was very scared, really scared. But when I arrived, their way of talking and calming me down helped, and I underwent a procedure called ablation to treat the high flow in my heart. And now I feel so much better, both psychologically and physically. I also want to thank them very much. There were some issues before the procedure. For example, I would get tired very quickly, extremely tired. I mean, even after walking just 100 meters, I would be out of breath. I thought this was normal, just something that came with my age. But after the operation, I saw that these problems gradually went away. I also felt that I became much more relaxed psychologically. I realized that this was not just some temporary so-called operation, but truly a very necessary and 100% successful procedure. My morale also improved a lot. I look at life more positively now.
Our patient, Mr. Sebahattin, is 65 years old. He was referred to us from an outside center with a diagnosis of arrhythmia for an ablation procedure. Of course, when the patient arrived, we also performed a detailed examination and reviewed his ECGs. We detected 2 different types of arrhythmia on his ECGs. One of them was a condition called atrial fibrillation, which originates from the upper left chamber of the heart, and the other was another arrhythmia called atrial flutter, which originates from the upper right chamber of the right atrium. Unfortunately, in the long term, these conditions can trigger heart failure in patients. In our patient's echocardiogram examination, we actually detected that the heart functions had decreased to some extent. In other words, our patient had told us about complaints of getting tired easily and shortness of breath. We saw the reflection of that in the echocardiogram. That's why we considered our patient suitable for an ablation procedure to break this cycle. Since there were 2 rhythm disorders in this patient, we planned to eliminate both by performing ablation in the same session. After the procedure, our patient returned to a normal rhythm. I believe we are now in the 3rd week of our follow-up. During these 3 weeks, there has been no recurrence of arrhythmia or rhythm disorder attacks. Sometimes patients are not aware of it. They may experience complaints like getting tired easily or shortness of breath, but they can interpret these as normal. After the procedure, when they compare their old and new states, they truly realize that they have improved. As I mentioned, heart failure has resolved, our rhythm is normal, and I can say that everything is going well.